What is your opinion on gum disease and how serious it is, and maybe like talk about that for a bit?
So, we have learned a lot over the times, and we now know that the mouth is a window to like what's happening to a lot of what may be happening in the body that a patient may not know about. So it's so important to constantly keep up with your hygiene and, do your regular checks, not just because to do it, but say for instance, a person had nice healthy gums and then they come in and now the gums are receding just unexplainably. Oh my gosh, doc, my teeth look longer now. Why are the gums moving? Sometimes that's insight to they have undiagnosed, uncontrolled diabetes, things like that. Sometimes a tongue that like looks like it's depapillated, meaning like it's really smooth, or burning tongue could be something that's happening in the gut, or just different things that manifest. You do an oral cancer screening with the mouth. Sometimes a lump on the side of the tongue or the floor of the mouth when we do oral cancer screenings could be some type of metastasis from cancer that may be happening in other parts of the body. So it's just really important to, keep up with your oral health, always make sure that the hygienist and the dentist can check things out. And then just, from the basic foundational things is that gum disease is not really curable. We can control it, but you don't really grow bone back. You have to do extensive surgeries to grow bone back. So we want to maintain you where you are. And then we try to educate the patient that when you have gum disease, you come in, we try to remind you to come in every 3 to 4 months, because we know that's how long it takes for all the bacteria to repopulate and also do more damage. So a patient will come in for a deep cleaning and they don't come back for 6 months. We now have to start the process again and decrease the bacteria load, and there may have been more likely yes than no. They now have more bone loss than what they had before because the bacteria had a chance to repopulate and do more damage. So we just try to educate the patient on that and the importance, of coming in, to at least decrease the bone loss, and then also so we can keep a very close check on, is there something else happening in the body that we may not, know. Funny story, I had my OB friend was telling me that she had a lot of jaw pain, and so it was completely unexplainable. So I said to her, well, why didn't you come to me? So she went to her GP, and the GP, she's like, I have this pain and I tried to take Motrin and it didn't make the pain go away. So they did some labs. She didn't say much, and she said, go see the cardiologist. So she went to see the cardiologist. He looked at her and he was like, didn't say much. He gave her a bottle of pills and tell her what it was. And he said, next time this happens, take the pill and tell me what happens. So next time it happened, about 48 hours later, she took the pill, called the doctor, and the doctor said, go to the ER immediately. She went to the ER and he said, you're having a heart attack. I say all that to say, and what she imparted on me was that heart attacks manifest differently in women. So now, now I know that. I tell patients, like, if you're ever having, unexplainable jaw pain, call me immediately. Like, don't try to think, oh, I'm gonna take some Motrin. Oh, I'll see Dr. Hart in 6 months. Like, it could be something else. So I've just been like, telling the patients about that because she gave me that blurb. And she's a medical doctor, and she's like, I'm telling you this because, this is your expertise. And I was like, and I didn't call you. And, and it was just such an interesting part. So here we are again, full circle, full body, holistic. Wow. Things manifest in the mouth in different ways when it's something else happening, in the body. So it's super important to keep up with the dentist, keep up with your hygienist, and keep up with your oral health, because it's really the window, to like a lot of things that are happening in the body.
I've also heard that like gum disease is linked to heart disease and like different types of things that now are coming out that like, your mouth actually has a lot of like influence over your whole body, and it's super eye-opening. Totally.
So mouth, gum disease, exactly what you said, heart disease, jaw pain, heart, is just really all, all comes together, like how it can really manifest. So yeah, exactly. The gum disease can definitely be linked to heart,
Right.
you know, when it's not functioning correctly.
So with gum disease, what are some signs and symptoms that, like someone like me who's just living my everyday life and I'm looking in the mirror, what would I be able to notice or see that then I would like come see you and be like, hey, I think there's an issue here?
If a tooth is shaky,
Okay.
if you see the gum starting to get red, if you happen to see like a pimple form on the gum line. Sometimes it's not root canal based. Sometimes it is actually something happening in the gums. It's hard to say sometimes what always elicits it or what starts it. So it definitely could be something happening in the body. So, but if you're coming every 6 months, at the very minimum, you shouldn't have that much buildup. So I don't want to say necessarily that, but something, if you're keeping up, it would definitely be the red gums flapping from the tooth, shaky teeth. You could have bad breath. That comes from just the bacteria. Some of the bad bacteria actually give off bad odor. So those are, really true tell signs. Red, angry, hurt, pus, things like that are usually something is going on. But like I said, if you're coming regularly, a lot of times those things don't really have a chance to manifest because we're on top of it and we're making sure that we're at least helping you keep the bacteria down and keeping the plaque, down. Flossing as well is crazy important to get in between the teeth to make sure that all those bacteria that build up, we can just scoop them out with the floss. If you don't love the string or you always feel that it hurts, you have options of water pick. There's so much different technologies that you can do that can still help you, stay on top of it. And then come to see us.